Good day, everyone. Today's article is titled Aggressive Neoplasms That Mimic Chronic Endodontic Lesions, a multi-institutional case series. It was done by a Brazilian group and it was published in Australian Endodontic Journal in 2025. The study reports on the socio-demographic, clinico-pathologic, and radiological features of 12 cases of aggressive neoplasms that were initially misdiagnosed clinically and radiographically as chronic endodontic lesions. Because roughly 90% of periapical radiolucencies are benign sequelae of pulp necrosis, clinicians often overlook malignant alternatives. And because it was reported in the literature that about 4% of suspected periapical disease turn out to be non-endodontic in origin, and some could be malignancies in nature. Misdiagnosing these lesions delay vital anti-neoplastic treatment and directly compromise patient survival. So they had a sample of 12 cases from the archives of 3 distinct oral maxillofacial pathology services in Brazil. They included cases that had clinical and graphic diagnosis of chronic endodontic lesions and available imaging, such as PAs, panoramic radiographs, and CT scans. The samples were obtained from endodontic surgeries, and histopathological data were independently reviewed by 3 oral and maxillofacial pathology specialists, each with over 20 years of experience. So they had 7 females and 5 males, and the mean age at diagnosis was 49 years, with a wide range spanning 16 to 75 years. Of the 5 cases where symptoms were explicitly documented, 4 patients reported pain, while only 1 patient was completely asymptomatic. For the location of these lesions, half the cases, which is 6 cases, were located in posterior maxilla, 3 cases were located in posterior mandible, 2 cases were in anterior mandible, and only 1 case was found in anterior maxilla. Crucially, the tumors perfectly mimicked benign cyst or granulomas radiographically, and 100% of the cases presented with radiolucent internal appearance, and almost 92% exhibited well-defined borders. Only 1 case showed ill-defined borders. Cortical bone perforation was identified in 2 cases, and expansion of the cortical bone was seen in 1 case. For the histopathological features, the case series identified 7 distinct histological types of aggressive neoplasms. First is the metastasis. 4 cases were diagnosed with metastasis, and it was the most common group, evenly split between adenocarcinoma metastasis and kidney metastasis. Surprisingly, metastatic jaw lesions are usually present with ill-defined margins. However, all of these cases presented with well-defined borders. Second is the squamous cell carcinoma in 3 cases, and it was found exclusively in men with a mean age of 53 years old. Also, malignant neoplasms of salivary glands in 3 cases. 2 of them were mucoepidermoid carcinoma, where they were atypically located in posterior maxilla. 1 case was diagnosed with Ewing's sarcoma, aligned with typical literature affecting pediatric patients in young profile, and presenting in the mandible, where 1 in 5 cases are routinely mistaken for dental infections. And lastly, 1 case was diagnosed with Langerhans cell histiocytosis, which is a rare myeloid dendritic cell neoplasm in adults. It did not display the classic floating teeth appearance typically expected of Langerhans cell histiocytosis. For the patient follow-up and survival, follow-up data were limited because many patients received definitive anti-neoplastic treatments outside of the dental school setting. For 3 patients whose survival status was retrieved, all were alive at the time of reporting. The Ewing sarcoma and Langerhans cell histiocytosis patients experienced favorable outcome post-surgical treatment with follow-ups of 8 years and 12 months, respectively. 1 squamous cell carcinoma patient was alive after 28 months of follow-up. However, this study has some limitations. First is the retrospective nature, restricted data recovery for older cases, leaving critical gaps such as the exact primary tumor location for the metastatic cases. Furthermore, because treatments were handed off to a medical oncologist, long-term survival statistics for the majority of the cohort could not be fully tracked. So the take-home message from this paper is that because aggressive malignancies can perfectly replicate asymptomatic and well-defined radiolucent appearance of standard periapical pathologies, clinical and radiological examination alone is insufficient. Reporting these cases shows how imperative it is that all tissues excised during endodontic surgeries undergo routine histopathological evaluation to avoid catastrophic diagnosis delays. And thank you so much for listening.